I'm Cindi Laws with Healthcare for Washington. First, I want to thank Representative Maycumber, Chairman Cody, Representative Schmick, and this committee for voting unanimously on House Bill 2662, which is a combination of this bill and 6113. So thank you for that great show of support. You know some of the statistics on this. 11.4% of the adult population of Washington has diabetes. The current population of the state of Washington is 7.6 million people. Using that calculation, we're talking about 896,000 people in the state of Washington have diabetes. It's the 6th leading cause of death in the United States. 20.9% of the senior population over 60 years old has diabetes. 60% of African Americans, or 60% higher incidence of diabetes in African Americans who are non-Latino. This is significant. The work that you're doing on these bills and 2662, 6113 is going to make a profound difference in the lives of residents. To address one of our other lobbying colleagues saying that there's no precedent, we know that's not true because the precedent is being set in numerous states last year in current legislative sessions with price caps, with other major reforms relating to making sure that there is coverage for insulin, making sure it's affordable for people. But it's also something we need to address with some of the other pushbacks. As you may recall, a couple of weeks ago, Ronnie Shore is a pharmacist who's on the board of Healthcare for Washington. And Ronnie served at Harborview, served in King County Jail, not as a pharmacist, not as an inmate. But he also, in his long-time career, worked a lot with the questions that many people had about rebates. The insurance companies will say, but there's rebates, or the drug companies, rather, will say that there's rebates, and there's all these other things. Well, there's a lot of programs that they do have you're only good for 1 year. You're only good if you qualify, and those rebates are only good on the brand name drugs. They're not good for generics. And so, and the loopholes, as Ronnie explained, the loopholes to get to those drugs are insane. And so it's much better when the state just does this and puts this on, and I think the consideration of doing a lower copay will certainly go much farther in making sure that the 890,000 people that have diabetes will not be dying. It does impact businesses, it impacts the productivity, it impacts students, and so let's solve this problem. This is an easy to solve problem. Thank you very much for your support of this bill. Thank you for your support of the similar bills. Thank you for your good work.